ASH 2015 coverage in Orlando. I'm Thomas Baldrick, joined now by Dr. Geoffrey Uy from Washington University in St. Louis, Missouri. Thanks for taking a couple minutes out of your conference for us, sir.
Thank you for having me.
Let's talk about your study. Addition of Sorafenib to chemotherapy improves the overall survival for older patients with AML. Why did you select Sorafenib for this trial?
So data that we've looked at in a number of studies shows that FLT3 is one of the most common mutations in AML, and the presence of this mutation has consistently been associated with high rates of relapse in this population. And Sorafenib has been demonstrated to be a very potent FLT3 inhibitor, and there were early studies performed at MD Anderson and in Germany that suggested that it could inhibit FLT3 in vivo and produce clinical responses. So we aim to add Sorafenib to a chemotherapy backbone in an attempt to improve the outcomes of this traditionally poor performing population.
What was the design of this study?
So this was a single arm phase 2 design in which we added Sorafenib to a standard chemotherapy backbone for older adults consisting of daunorubicin and cytarabine. They received Sorafenib twice a day for the first 7 days during induction chemotherapy. And for those patients who achieved a response, they then went on to receive 2 cycles of consolidation with an intermediate dose of cytarabine with Sorafenib, and then 12 months of maintenance Sorafenib therapy.
What were the major findings?
The study was powered to look at a 1-year survival endpoint. In our historical databases from the Cancer and Leukemia Group B, we observed that this patient population historically has a 1-year overall survival of 30%. In this study, we observed a 1-year overall survival of over 60%, pretty much doubling what our historical results were.
Dr. Uy, how did that meet did you have expectations? But that's pretty significant improvement.
No, we do think that it was a vast improvement over what we currently expect with this population, and I think that this has the potential to have a major impact on patient care.
So where do you go next with this?
That's a tough question. Sorafenib is a clinically available drug. It's approved for patients